Hi, everyone. I'm excited to be here and talk about our work in Nyanza Province, Kenya. The title of the talk is there, and I would like to acknowledge the co-authors and also the fact that this was funded by the UCGHI Center for Expertise on Women's Health and Empowerment. So the methods, we conducted 12 small groups with married men, 106 total, between the ages of 20 and 66 in 2 rural districts in Nyanza Province, Kenya. And the objectives were to explore men's family planning perceptions, their perceived barriers, as well as to identify potential intervention strategies. And so I'm just going to move right into themes. And there were 4 major themes that emerged from this study that relate to men's fears in engagement in family planning. So the first one is the belief that family planning really threatened male gender roles. So men were expected to be authoritarian, dominant, controlling head of households, and that men feared that if they became involved in family planning or people knew about their approval, that they would be seen as being controlled by their wives. And one of the quotes is that a man will be gossiped about, that his wife has overpowered him, and that is why he is taking her to the clinic. They also worried about being labeled as not being able to function sexually. The second theme is related, and that was males were expected to have a lot of children. So these expectations that men father a lot of children were related in part to the societal or tribal culture. And so men feared that if they didn't have large families, they would be seen as embracing Western values, as being too proud or being snobs, or also, they felt that if some of the children died, they wouldn't have the opportunity to replace them because they really associated family planning with limiting and not spacing of children. The third theme I wanted to highlight has to do with side effects, and there was a lot of discussion in our groups about side effects. Perceived side effects, as Dr. Tavro mentioned, had to do with infertility, birth defects, that contraception caused cancer, diabetes, and many other side effects. But one interesting theme that I wanted to point out is the belief that women's contraceptive use also was related to women's libido. So for part of the group, men felt that contraception actually decreased women's libido, which would then force men to go out and find other partners and increase their HIV exposure. But the other group of men felt that family planning use among women would actually increase women's libido and lead to increased female promiscuity and exposure to HIV that way. So it was interesting that there was these 2 beliefs. And then another large theme that came out was the fear of coercion by family planning providers, that men were really worried, and they discussed a lot about their reluctance to attend family planning clinics because they felt that the providers would coerce them into having vasectomies, into disclosing HIV tests, or extramarital sexual activity to their wives. And they also felt uncomfortable in discussing sexuality with their wives. So some major conclusions from this study. First of all, while most men said they approved of family planning, it was clear that family planning overt acceptance was highly stigmatized. And it really related to gender roles and male identity, and their fear of how they would be perceived by others. In terms of intervention strategies, men came up with 2 priorities: increased family planning education and changing community norms to support more engagement by men in family planning. They in particular suggested male outreach workers or village leaders who could promote family planning use among men and correct misconceptions. So family planning providers should be sensitive to male fears and understand where they're coming from in order to encourage this. And my final conclusion is that increased awareness of the positive gender benefits of family planning could encourage more use among men. Thank you so much.